In this lesson, we're going to talk about Handoff Report. Handoff Report is basically your change of shift report. We often call it report. It's essentially you're handing off care from one nurse to another. So you're going to give a detailed report. We use these reports at bedside, and we're going to talk about that a little more later. But the goal is you want to be clear and concise. They're detailed. They'll go nurse to nurse. You will use them between units. So if you're going to go nurse to nurse, this happens at bedside. And they're used between units. So if you're going from like ICU to the floor, you would call report to the new nurse, taking care of the patient so that they have an idea of what's going on. The thing that you want to do with a report is you want to paint a picture. When we give report, we want to give report literally at the bedside. It's known to be best practice. And the reason is because it increases safety and the quality of care for the patient. It puts the patient first and at the center of what's going on, so they can be included in plans of care and updates and medical history. Having the patient tell you exactly what's going on with them, at least previously, can also help to give some insight as to what's going on with the patient. The other thing it does is it encourages patient and family involvement in the plans of care. And also it helps to confirm what the previous nurse told you about what's going on. So things like IVs, line strains, airways, those kind of things, you can confirm with what the patient is telling you. If you have a patient that had a breathing tube and it was 25 at the teeth and you walk in and it's 24 at the teeth, we know that that's moved around a little bit. So you can actually confirm what's going on with your patient by having the nurse at bedside. When you give a report, the biggest, most important thing is to develop a routine. You always want to be consistent in how you do it. Typically, in most units, you're going to start with something like a medical history. So that include allergies, any big medications. So think drips in the ICU, current code status. So you got to know that. You also know about any plans for care. So you'll talk about like transfers or discharges. These kind of items are going to be upfront, kind of in the beginning. Are we going to extubate the patient? But we'll talk about more of that a little bit later. Then you want to go system by system. When I was in the ICU, I always did it the same way. So it was neuro, cardiovascular, pulmonary, GIGU, musculoskeletal, and then skin stuff. And then you'll have like little breakdowns of anything in between. But the most important thing was I always went this way. I did them in sequential order, so I never missed anything. If you do it the same way every time, you miss less information and you also don't get misinformation. Which goes on my next point. You want to give succinct information, be clear, concise, clarify any concerns for your upcoming nurse. So I had one time a patient who was going to get peritoneal dialysis, and I had never had a patient who had it. But the nurse that was coming off shift was awesome enough to give me some insight on how to do it. The other thing I did was I actually asked the patient how he did it. And so by doing this, I gave a report at the bedside. He helped clarify concerns. So by the time I was done, it was this big daunting task in the beginning. It turned out to be way easier. Another thing you're going to want to talk about with the new nurse coming on is, or if you're coming on, are safety issues. You want to check your restraints. You want to check any precautions. If your patient's going to the OR, you want to make sure that those things are all squared away. Don't just trust the nurse that things are taken care of. What you want to do is you want to protect yourself. So if you're told your patient has OR consents, look at the record. Make sure that your consents are signed. If your patient just had restraints taken off, you want to know when that was done, because if you have a patient that had restraints removed an hour ago and they're doing okay, that means you need to watch them a little more closely than, oh, hey, I took his restraints off at the beginning of shift and he was totally fine the whole day. That will tell you an idea into the insight into the patient's cognition and if they're going to follow commands. So these are things to check out in terms of safety. The other thing are like precautions. So these things are like droplet, or you have TB precautions, or you have C. diff precautions. You want to make sure that all of these things are in place, or if they've been removed. That way you know, and that you're protecting yourself and the patient. And lastly, you want to make sure that you're honest. You always want to be honest when it comes to safety. Like I was talking about with the restraints. Just if your patient has only been off restraints for an hour, be sure to tell the nurse, he's been off an hour, he's been okay, but you need to watch him closely. Don't just leave that out for the other nurse to have complications or to risk patient safety. Like we had talked about in kind of a general overview of giving handoff report is talking about plans of care. You want to make sure that you update the new nurse on any upcoming operations or procedures. Hey, we're expecting an IM nail in 2 days. Should go to OR on Thursday, so that they have an idea and they can translate that to the next nurse, so that they make sure that consents get signed, so that they're updating the family. The other thing you want to do is include any upcoming expected changes. So if we think they're going to discontinue a Foley, you can anticipate it. And you can also be a cool work partner and go grab your patient supplies. Hey, I think they're going to take the Foley out. I pulled your stuff. It's sitting right here. Cool, great. You've actually saved that nurse a trip, and they're already busy scheduled at the beginning of shift. The other thing is also anticipating a transfer discharge. So if you think your patient's going to go to the floor and you think they're going to be sent home, let that nurse know so that they can kind of anticipate. Hey, if your patient doesn't need to be in the ICU and they can go to the step-down unit or they can be on the floor, then let them know, hey, he's been fine. I don't even know why he's here. Let's see if we can move him out so that we can actually take care of ICU patients. Or, hey, does this patient need to be, hey, he hasn't been doing well. I anticipate that he may bounce back to the ICU. Let them know so that they can actually plan for that in their care. Nursing concepts for today are communication and teamwork and collaboration. So let's recap. First off, handoff report is about giving detailed information. You want to paint the picture of what's going on with your patient. Give report at bedside. You want to involve the patient. You want to involve them in their care, and you want to involve them in having positive patient outcomes. When you give report, give them by system. Go and create a routine. Help yourself out. If you do that every time, you're going to consistently and eventually more efficiently give a report. Include plans of care and safety, and address safety concerns with the new nurse. Like we talked about, developed a routine, give report the same way every time. That's it for our lesson on handoff. Make sure you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.